Hey everyone, and welcome to today's Explainer. Today, we're absolutely demystifying affordable healthcare. We're going to figure out how to get you covered without the usual headache. Because let's be honest, if you've ever felt totally overwhelmed by all that insurance jargon or just stressed out by the sheer cost of keeping your family covered, well, you are in the exact right place. We are going to break down exactly how you can tap into financial assistance programs that, frankly, you might not even know you qualify for. By the end of this, I want you walking away feeling empowered, confident, and 100% ready to take control of your healthcare costs. Let's get right into it. So here's our game plan for today. We're going to start by unlocking those ACA health subsidies. Then we'll look at the two different types of savings out there. After that, we'll dive into income rules and eligibility, face the reality of tax time, and finally, I'll share exactly how to get some expert help. All right, part one, unlocking ACA health subsidies. I want to start by asking you a very direct question. Are you overpaying for health insurance? Seriously, take a second and think about it. High insurance costs can literally feel like a heavy anchor dragging down your family budget. It's stressful, it's confusing, and it's exactly why so many of us just accept whatever premium we're handed without asking a single question. You pay that bill every month, but do you know if you're actually legally entitled to financial help that could slash that number? People tend to think of tax codes and health laws as these, abstract concepts that only accountants care about. But the reality, if you don't understand the system, those abstract concepts are literally draining hard-earned dollars right out of your personal bank account. So what's the fix? Well, it's ACA Subsidies. The Affordable Care Act, which you've probably heard called Obamacare, provides this incredible financial assistance. These subsidies are custom-built for low to moderate income individuals and families. The whole point is just to make health insurance purchased through the marketplace actually affordable. Depending on your unique situation, these subsidies can drastically lower your monthly premiums, and in some specific cases, they can even lower what you pay out of pocket at the doctor's office. And to be super clear, this is not a loan. It's financial assistance designed specifically to help you out. Moving right along to part two types of savings. When most people hear the word subsidies, they kind of just think of it as one big generic discount. But the ACA actually gives you two very distinct, specific tools to keep your hard-earned money right in your pocket. So on the one hand, we have premium tax credits, or PTCs. Think of PTCs as the discount that lowers the actual bill you pay every single month just to have the insurance. And it works on a sliding scale, so the lower your income, the higher your subsidy. On the other hand, we have cost-sharing reductions, or CSRs. While those PTCs bring down your monthly bill, CSRs reduce the bill you pay when you actually walk into the doctor's office. They lower things like your deductibles, your copayments, and your coinsurance. The marketplace actually calls these extra savings, which is a pretty great name for them. Okay, so here is the absolutely crucial point. How do you actually get your hands on those cost-sharing reductions? Well, there's a golden rule you have to follow. To benefit from CSRs, you absolutely must enroll in a silver level plan through the marketplace. Seriously, this is a big deal. You can use your premium tax credits for any metal category, bronze, gold, whatever you want. But if you want those extra savings that shrink your deductibles and copays, silver is literally the only way to go. Generally, your income needs to fall between 100% and 250% of the federal poverty level to snag these. And honestly, the best part, it actually lowers your out-of-pocket maximum for the year. Once you hit that new lower max, your insurance steps in and covers 100% of all covered medical services. How amazing is that? All right, Section 3, Income Rules and Eligibility. Now, this is arguably the most critical part of our whole journey today. Everything we've talked about so far, the PTCs, the CSRs, it all hinges on the math that determines your eligibility. And understanding this clears up a massive source of confusion. We've got two different terms. First is your adjusted gross income, or AGI. This is your total gross income minus certain deductions, and you can literally find it on your tax return, specifically IRS Form 1040, line 11. Easy, right? But the marketplace doesn't actually use AGI. They use Modified Adjusted Gross Income, or MAGI. And here's the kicker. MAGI is not a line on your tax return. To figure it out, you start with your AGI, and then you add a few things back in. Things like non-taxable Social Security benefits or tax-exempt interest. Now, for a lot of folks, AGI and MAGI are pretty darn close, but knowing the difference is absolutely essential when you're reporting your expected income. Let's actually apply that MAGI to some real numbers using the federal poverty levels. I want you to think about a family of 4. To get those premium tax credits, your income generally needs to sit somewhere between 100% and 400% of the federal poverty level. So for a family of 4, that 100% mark starts at $33,000. Now, if we jump all the way up to the 400% threshold, that goes up to $132,000. That is a massive window, right? If your family of four makes anywhere between $33,000 and $132,000 a year, you're in the zone to get financial help with your monthly premiums. And it gets better. If that same family makes between $33,000 and $82,500, which is the 250% mark, they also qualify for those cost-sharing reductions we just talked about, as long as they pick that silver plan. Now, you might be wondering, what if my job offers me insurance? Well, that brings us to this number, 9.96%. This is the employer affordability rule, and it is a real game changer. If your employer offers a health plan and your share of the monthly premium for a self-only plan is less than 9.96% of your total household income, the government actually considers that coverage affordable. And if it's deemed affordable, yeah, you might not qualify for those marketplace savings we've been talking about. Keep in mind, this calculation is based strictly on the cost to insure just the employee, but it's measured against the entire household's income. It's a pretty strict rule, and honestly, it catches a whole lot of people completely off guard. Section 4, the tax time reality. Okay, we've talked about all these fantastic savings, but we do need to get real for a second and talk about some of the catches. Because if you guess your income wrong, tax season can get really stressful really fast. Let's walk through how this tax reconciliation process actually works. First up, when you apply for coverage, your subsidies are totally estimated based on what you think you're going to make that year. Fast forward to when you file your federal taxes. The IRS takes a look at what you actually made and compares it to that estimate you gave the marketplace. And step 3 is where reality hits. If you made less money than you thought, awesome. You might actually get some extra subsidies in your tax refund. But if you made more money than you estimated and you completely forgot to update the marketplace, you could be forced to pay those excess subsidies right back to the IRS. Yikes. And that whole reconciliation process brings us to what is probably the most dangerous number in the ACA, 400%. Folks in the industry called us the subsidy cliff. Remember that federal poverty level range? Well, if your modified adjusted gross income goes even one single dollar over that 400% mark at the end of the year, your subsidies don't just gently taper off. They end abruptly. You literally fall right off the cliff. And you could be on the hook to repay every single penny of subsidy assistance you got all year long. No joke. This is exactly why managing and accurately reporting your income is absolutely 100% crucial. Finally, Section 5, let me help you. Look, I totally get it. Navigating AGI, Magi, Silver Plans, subsidy cliffs. It can honestly feel like you're trying to defuse a bomb in the dark. It's a lot. But if your head is spinning right now, take a deep breath. The creator of the materials we're looking at today, Eric Burns, is a licensed insurance agent, and he literally does this every single day. His team is licensed to help folks in 10 different states: Alabama, Florida, Georgia, Mississippi, North Carolina, Ohio, South Carolina, Tennessee, Texas, and Virginia. The sources highly encourage you to jot down his contact info. You can call his office directly at 678-404-9230, or just shoot him an email at eric@ericburnsinsurance.com. Do not navigate this alone. Reach out to get expert help securing your subsidies, picking the right silver plan, and avoiding those nightmare tax time mistakes. So I'm going to leave you with one final thought today. Are you ready to secure your family's health and finances without all the confusion? You've seen the math now. You've seen the incredible potential for savings, and you know exactly which pitfalls to watch out for. Now it's time to take action. Seriously, do not let the fear of confusing jargon keep you overpaying for even one more month. The experts are standing by, ready to have a real conversation and get you and your family on the path to truly affordable care. Thank you so much for hanging out with me for this explainer today, and I absolutely can't wait to explore more with you next time.